TMJ arthrocentesis is the procedure which is being performed. This is a procedure which involves lavage of the joint space because of the inflammatory mediators that is causing the TMJ pain for the patient. Also, some restrictive movements. So, this is a two-needle technique, which is the two needles are placed, it's a straight line which is drawn along the medial portion of the tragus of the ear to the outer canthus of the ipsilateral eye, and then we mark these 2 points for needle insertion. The first is about 10 mm from the tragus, and the second one will be 20 mm anterior to the tragus and 10 mm inferior to the canthotragal line. Arthrocentesis, which is nothing but lavage or flushing of the TM joint. This is done to get rid of the inflammatory mediators, and the procedure involves a two-needle technique, which we place the two needles, one anterior, 10 mm anterior to the tragus, and the second one 20 mm anterior and inferior to the tragus. So this flushing technique involves use of RL, ringer lactate, and NS. And once the joint cavity is flushed with around 300 to 500 ml of solution, we know that the inflammatory mediators have been flushed out from the joint. So this will be effective for patients with TM joint pain, restrictive movements, some disc issues, disc problem, articular eminence, which is intruding the joint space. So for these patients, these kind of procedures are beneficial.